Welcome to Breath of Fresh Air, the podcast bringing fresh insight and real talk to the world of dental practice management. Your hosts, Amanda Demora and Sarah Hamlin, are two industry insiders who've seen it all from the front desk to the C-suite. Amanda, the founder of Essential Dental Services, now Daydream Dental, is an operations consultant, business coach, and practice management expert. Sarah, former COO of Essential Dental Services, continues her leadership journey as the COO of Daydream Dental, a cutting-edge dental billing company. Together, they deliver unfiltered conversations on dental office operations, leadership, revenue cycle management, team dynamics, strategy, industry trends, and more. Designed for practice managers, dentists, assistants, and front office professionals, this podcast is the ultimate resource for anyone looking to optimize and elevate their dental practice. Take a deep breath, because Breath of Fresh Air is here to shake things up and help dental teams build smarter, smoother, and more successful practices.
Hi, everyone. Welcome back to the Breath of Fresh Air podcast. I'm Amanda Demora.
And I'm Sarah Hamlin.
And today, before we get into our topic, Sarah, what's been new with you? I know that it's school vacation week, so...
Yes, spring break week here, which is always a fun time as a parent, but we're doing well. We just got back from a little trip and we had a lovely time. We were back visiting friends and family in Montana, which was delightful, and we had really lovely weather, and then it snowed like 5 or 6 inches last night, and we got back yesterday midday, so I'm glad we missed that.
What? You're glad you missed it, but you don't hardly get snow anymore. Like,
yes. I mean, it would have been nice if we were there to play in it, but as it was, it would have just like probably impacted our travel day instead of being like fun for us to play in it. So it was all right. I'm glad we missed it, honestly. And by mid-April, the snow is probably not top of my list in mid-April. If it was January, maybe, but not in April.
That is sort of true. We had a little surprise, like couple inches last week, I think. Mm-hmm. And obviously my son was very excited about it. But for me, I mean, all the flowers are coming up and then they get snowed on and they die and it's just not good.
I know.
But so how did you and your daughter got upgraded to first class?
Yes. On the way home, we did. Me and my daughter did. And then unfortunately, the boys also got upgraded to first class later in the day too, which was fine. But my daughter when that happened, she was like, Mom, can you change their tickets so they're in the back of the plane? She's was really trying to milk that first class situation.
She's feeling very smug up there, just the two of you.
Yep. So we all did get upgraded, which was a fun experience for them for sure.
That's never happened to me. I don't fly a lot, but that has never happened to me. I don't know why.
I suspect it only happened for us because it was a pretty light flight. Not a lot of people flying from Montana to Seattle midday on a Wednesday, I guess.
Okay, maybe, yes. Maybe if I'm taking more obscure flights, I'd have a better...
Yes, exactly.
Have a better chance of it. I don't mean to talk about Starbucks every time we are recording, but have you ever had a birthday cake pop from Starbucks?
I don't know. What are they like? Confetti colored? I mean, my kids get them all the time, but I don't know which one's the birthday one.
The pink.
Oh, yes. We've definitely had the pink.
They are... Now, I have obviously had them in my life for... I can remember having them at least 15 years ago or whatever. Mm-hmm. But they are my absolute new obsession to the point where the other day I got one in the morning and then I went there after I picked the kids up from daycare. Last night, my husband and I are laying in bed about to go to sleep, and I said to him, I'm like, all I'm thinking about right now is birthday cake pops from Starbucks. I'm just addicted. So addicted. I don't know why. They're just so good.
You know what's funny is when I was pregnant with my kids, one of the things I craved a lot and ended up having to figure out how to make homemade were cake pops. I don't know if it was the texture or just like a sweet treat or what, but I think my poor sister made me cake pops like 3 or 4 times when I was pregnant. So I hear you.
I did. I found maybe a couple months ago, or I can't remember if I was still pregnant at that time. Because this all kind of did stem during pregnancy. So clearly you and I, same wavelength of cravings.
And that explains why our kids like to eat them so much now too, I guess.
Yes. I did find like a copycat recipe for the Starbucks cake pops, and I did make them, and they were very similar. But the only dangerous part about doing that was I was eating like 4 at a time, and not just the one that I'm getting through the drive-through. So anyways, okay, let's jump into today's topic, and that is going to be culture within the dental office. Not, always, I think, a topic that is at the top of our mind every single day, but definitely super important, I think. And actually, Sarah was just jumping off another meeting about culture, so I'm hoping she has a lot to lend to this episode.
Yep.
So kind of just defining what culture even is, I think is important. And to me, as a practice manager, culture is what it feels like to work in the practice and also be a patient in the practice.
Yeah, they definitely the culture crosses those lines, from the internal team to the patients and even other providers and your kind of reputation and culture with other offices around you or specialist offices. It definitely trickles down into all aspects of the business.
Absolutely. And I think for a lot of us practice managers out there, the dental community is a small community, right? If people are leaving your office or coming to your office, they probably know someone else who works at your office and what it's like to be there. And, news travels fast, and you want to have a good reputation culture-wise. So, and that will bring in the best of employees for sure. So it's the real feel of your dental office, and that's kind of what we're going to focus on today. I love this meme that I see a lot, and it's kind of like some kind of picture. It's like, when the office or when the workplace is a dumpster fire, but your manager brings pizza.
Yeah.
Expecting that to fix everything, which, a little pizza never hurt anybody.
I mean, I see those memes too, and I think it is funny and definitely applicable, but I kind of agree. In my heart of hearts, I definitely don't complain when there's free food, especially when it's pizza, because that's one of my favorite things. But yes, it's not, those are not quick and easy fixes for culture problems in an office, right? You can throw as much free pizza and gift cards, and, Starbucks gift cards might work better for some people than others, Amanda, but...
Birthday cake pops.
Yep. But truly, those kinds of tiny little things are just a Band-Aid for bigger culture issues that might be at play. And I do think it is kind of a telling action of a lot of companies to try to just throw some pizza at it and hope that that's going to be the solution to the problem. And it's almost never helpful.
We may as well try to start there, though.
Yeah. Baby steps.
Right. So to me, culture really comes from the top. And I have worked in some really great practices and really poor practices with poor culture. And again, it just really stems from the top. And by the top, I really mean the practice owners, the doctors. And then right under that is going to be your practice manager. I think, we're going to focus a lot on how a practice manager comes into play here with culture. And one thing that comes to mind immediately is, just because you're a dentist or you're a practice manager does not mean that you're gonna be great at kind of leading the charge culture-wise. Sometimes that's just not in people's personality, and that's, kind of unfortunate. if that is something that you know about yourself, like, hey, maybe I'm like not the best, or I'm super shy, or whatever it is, it's really something you need to work on. If this is something you care about in your practice, is what the vibes are. Again, it's a personality trait. My practice right now that I manage, the doctors are amazing. They're wonderful people. They're great leaders. And that trickles right on down to the rest of the staff, and people feeling really kind of lucky and appreciated, and all of those things that are important and give us the warm and fuzzies and make us want to stay at a practice. Mm-hmm. And of course that trickles down to me, the practice manager. It sets a precedent and an example, and I want to continue on what they're laying the foundation of. And I've worked in some practices where that really just was not the case, and I couldn't wait to get out.
Yeah. I think to me, the most important part that I would point out about this culture discussion is that a good culture is a conscious choice. Like, you can't go into this, wanting to have a good company culture and not have given it some real thought and actual effort at the beginning. And it's something that's a little bit tricky, right? You think, oh, sure, I know what good vibes for my office means, or I know how to explain what I want the culture of my office to be. But if you really sit down and give it some thought, I think it's not quite as easy to put into words or explain to somebody else as you might think. So definitely taking some time to think it through, put some things in writing so that you can share that with everyone as a good kind of baseline. Also for a reset as yourself on the leadership team too. Sometimes you get so bogged down in the day-to-day, or so bogged down in one toxic team member and how, what should I even do about this? And being able to kind of go back to that document that you wrote, at the start of the practice, or whenever you decided to adjust the culture, and reflect on it and say, no, at some point I felt really strongly that, these should be our values and this is what we should be standing for, and I need to, stick to that. That can be really helpful, especially in trying times, or times where things feel really unaligned with what you wanted originally. So that's my first, main recommendation is put it down, write it down, and put it somewhere where you can reflect on it and remember it, and have that reminder of how you want things to be, big picture and long term.
I like that, because we talk a lot on this podcast about SOPs and things, and this is kind of no different. So writing it down and being able to go back and look at it and remember and remind yourself, like Sarah said, of why you wanted to do these things. And even just, obviously we all can't remember every single thing. So having things written down is perfect. Let's talk about some maybe red flags in a dental office. I think the first one, biggest red flag, would be a high turnover. People, leave for a reason. And, you kind of will notice the offices that are hiring all the time, or maybe you go for an interview. And this is actually something important, I think, to ask at an interview is, how long has most of the staff been here? What's their longevity? At my practice right now, I'm obviously very proud of this practice. And we have one hygienist who's been there over 40 years. Many who have been there over, 30, 20, 10. I'm coming up on my 20th year myself there. I started when I was just a little baby. And that says something. People, like I said, people like being there. I think it is very comforting. They feel appreciated. They know they work for great people, and there's something to be said for that. So definitely ask that at an interview.
Yeah.
Go
ahead. I was just going to say, the other question I would ask, kind of dovetailing off of that too, is why is this position open? Is it open because the office is growing and you're adding more people? Is it open because you can't keep anyone in this position and this is the third time you've had to hire for it? Just kind of asking those kinds of logistics too, I think are great indicators for you of what's going on at the office.
Right, and it might actually catch someone off guard when you ask that, and that might lend to the actual truth. Oh, the last person quit because she wasn't getting along with someone else. And then I might ask a little bit more about that situation.
Yep.
More red flags, gossip, cliques. I think, this is something a lot of offices struggle with for sure, and sometimes even generational gaps. There's this kind of age-old millennial versus baby boomer, or Gen Z versus baby boomer, and different work ethics and things that are important to different generations. And that can get tough, for sure.
Also, in the dental office, I think we can all kind of relate to departmental struggles and issues. I think we hear a lot of times about the hygiene department says this, and the assistants say this, and the front desk says this, and the doctors are saying this, and it can be hard to maintain like a company-wide alignment. And when we talk about the office manager and the office manager's role in all of this, like it really is, the office manager's job to kind of be the one that brings all of those different departments together. That's not an easy job, but definitely is key to trying to keep the gossip and cliques down, is having somebody that kind of acts as a go-between from all of those positions too.
Right, the front and the back struggle, kind of a tale as old as time there.
Yes.
But lack of communication, and this, whenever there's changes within the office, I always try to honestly just be really upfront and honest with everybody. That's kind of all I know how to do. I think it's appreciated. I don't think people like finding out about things because they heard from so-and-so, or, whatever it might be. So being upfront and honest is important. What else we get?
I mean, I think also, lack of communication, but also maybe, I don't want to say like inappropriate communication, but like misguided communication, which kind of ties into our next thing, which is like, potential toxic positivity. Like this is something I'm a real champion for when it comes to communicating, is like it is actually usually in people's best interest, and also helps people feel seen and heard. And when you validate their feelings, like, you're right, this was a really unfortunate situation. I totally understand that you're frustrated, and I would be frustrated too. But here's how we can get through it, or here's how we can find a solution, or here's, something that might help us move forward from this in the future. I think a lot of times leadership can really take a everything's great, we're always so happy kind of approach to these communications, and that's not always well received by the rest of the team too. So we don't want a lack of communication, but we also want to just be mindful of like the tone of the communication as well.
Mm-hmm. Favoritism, one person getting away with everything. Definitely, see this in practices. That's a no-no. If that is going on in your practice, please try to be mindful of it. It really is toxic to the rest of the team, and it's not going unnoticed by any means. It might not being expressed to you, but it is not going unnoticed.
Yep.
And then, I've experienced a little bit of this myself, and, it hasn't been my mentality, but experienced team members who had this mentality, and it's that's not my job mentality, or someone who's kind of keeping track of things that they're doing at kind of like not a tit for tat thing, but people who feel like they're working harder than everyone else, and they're kind of keeping track of those extra things, quote unquote, that they're doing.
Yep.
And that's just a poor mentality to have. That's not a team mentality at all.
Yep.
It's petty for sure.
Yeah. And like, also, let's say too, that like usually these kinds of like mentalities are like a downstream effect of some of the other red flags, that have happened before. So as soon as people feel like they're not getting, recognition or appreciation for the things that they've done, or somebody else is getting called out or, favorited and instead of them, or if, they're not getting communicated to, or if there is gossip and clicks, like all of those typically end up in, one or more team members having this "that's not my job" mentality, which then, things just kind of continue to spiral and snowball from there. So I think if you have somebody on your team who is kind of acting in that way, obviously that needs to be addressed with that specific team member, but also a good indication for you to like take a step back and look upstream of that and say, what else might be happening here that, we need to review or evaluate to try to see like how did we get to this place in the first place.
Mm-hmm. All right. So now some green flags. Well, a lot of the green flags we have listed are really just opposite of the red flags, but low turnover and long-term staff, people feel supported and valued. They stick around. Open communication, team meetings, again, at an interview, maybe ask how often do they have team meetings? Because I think you'll be surprised. Some offices are really never. And that just gives no one the chance to ever offer improvement and suggest things, and for everyone to even just come together and feel like a team. So ask that question. Supportive leadership. Leaders are approachable. They're transparent. Do your employees feel like they can come to you with things? Celebrations and acknowledgement. That's another green flag. Big wins, big or small, get recognized and celebrated.
Yep.
Team accountability. Everyone pulls their own weight and takes ownership while obviously working together.
Yep.
The next one I really like, continuous learning is encouraged. So training, CE, all that stuff are valued and encouraged and hopefully paid for by the dental office.
Yeah.
I always, actually just yesterday, I sent a message to our whole team about some CE that I just took and I really liked, that was free, and encouraged others to do the same. And I try to do that every so often, send them things that I really liked. One of them in particular was, the new kind of policies and procedures for antibiotics and pre-medicating before dental procedures. That's a big topic right now.
Yep. I think some of the other, again, this kind of ties back into the red flags too, but it's like also there's some soft skills that, you can take some CE or learning or growing on too. Like I think in a dental office, a lot of us are thinking exactly like you said, new procedures on antibiotics and CPR, first aid training and OSHA training. And, those certainly are CEs and they certainly are things that we need to stay up on. But there's also like classes and coaching and books that you can read regarding, how to be a good teammate and how to communicate effectively, and those kind of more soft skills that will definitely help you be a better coworker, but can also help you be better at caring for your patients and, presenting treatment plans and how do you explain periodontal disease to your patient. All of those things, there's certainly learning opportunities related to those kinds of skills as well. So don't pigeonhole yourself when you're thinking about CE. There's lots of ways to learn and grow that aren't just related to the clinical side of dentistry.
One thing I really like, kind of piggybacking off that, is offices that sort of pick books as sort of a book club that kind of go with that, and how to work together great as a team and different things like that. Or it doesn't even have to be related to that. It can be any old book. It's a way for you guys to come together, but maybe kind of alternating a little fun fiction with things that tie into professionalism would be a good idea. And we've done a book club at my practice, and it was always a lot of fun. And like I said, brought us together.
Yep.
And then our last one on here goes right along with this too, is laughter in the dental office. I really love when I walk up to the front desk and they're, laughing and they're having a good time. Or, I kind of go into the back stairy area and the assistants are back there singing and chatting and whatever they're doing. I'm glad to see that people are having a good time. Of course, yes, all the work needs to get done. As long as that's happening, I'm really happy to see others be happy. And I like jumping in on those things too, and hearing what they're chatting about and things like that. So,
yep.
Walk around a little, see what the vibe is for sure. And, are people talking to each other and laughing and sharing little inside jokes, or do they seem miserable?
Yeah, exactly. And enjoying each other's company. I think that's a hard thing too about culture, is I think a lot of times people think that they have to be kind of, best friends with their coworkers. And I don't think that that's, when we talk about culture and laughing and enjoying each other's company, it's not that we expect everybody to be best friends or to having to be, hanging out outside of the workplace. Certainly that doesn't have to happen, but there definitely needs to be a level of mutual respect and friendliness in the workplace. And that can still lead to, enjoyable conversations and laughter and like a lighthearted feel in the office. Doesn't mean you guys have to be BFFs or besties or anything, but you can still enjoy each other's company in the workplace in a way that feels good to everyone else.
Mm-hmm. So as the office manager, how are we shaping the culture? How are we being the cultural architect? Well, I think a few things kind of go into that. As an office manager, how are you responding to drama? Me personally, when things have happened or, there's a little dust up somewhere, I don't like to react at that very moment. I like to let the team know, or however many people are involved, that I need to think about this. And usually I will address it. Depends what it is. So if this is some kind of massive dumpster fire that needs attention right then,
sure, that's
different. But in general, I like to think about it overnight, and I like to respond to it the next day. Mm-hmm. And are they, as a practice manager, how are you modeling respect to all the roles? Again, me personally, I truly believe everyone in the practice is working their butt off. The dentist, the hygienist, the assistants, and my front office team. I don't like to think, the assistants are lazy, or I've just never thought that. I do know a lot of people do. And I don't like to hear, anyone say that about other positions either. And I try to nip that right in the bud. Listen, everyone here is doing something a little different, but we're working together as a team, and everyone's working really, really hard. So I don't want anyone to be disrespected in that way. Mm-hmm. So me as the practice manager setting that tone, I think kind of goes a long way. Mm-hmm. What else?
I think, and kind of along that same line is just assuming the best of these people and your coworkers. I think a lot of times it's really easy for us to go straight to assuming the worst and thinking they're being such monsters. They're doing this on purpose because they know it bugs me. That's why they're doing this. But if you really lead with coming from a place of assuming the best of these people, then it's a lot easier to kind of remove some of your emotions and feelings from things. And exactly like you said, just assume that everybody's trying their best and doing all that they can to make the practice a better place.
I think even putting yourself, I started in hygiene school, and I've been a dental assistant, and I've kind of done all the various things throughout the office. And I think that really made me appreciate each role a little bit, maybe more than I would have if I hadn't done those things.
Sure.
But if, you haven't, I would try to observe some of these positions, even if it's just for an hour or two, and really kind of take note of what they're doing. In the very, very rare scenario that I have had to jump in and be an assistant over the past couple of years, Now, normally this is just like a patient or two, and it hasn't happened very much. But man, do I just find like even more
Yeah.
even more compassion for them. I also think I was a lot thinner when I was an assistant because they were just running around like crazy.
Yep.
And, when you're not in those shoes, it's easy to forget and look over things. But setting the tone on how you want your team to be really comes from yourself. Mm-hmm. So I try to come in, leave my problems at the door, walk in, be happy. And honestly, I really am happy to be there. So it's easy for me to do this. But leave your problems at the door and try to promote positivity and setting a good example for what your team should do as well. All right. So kind of rounding out, I think, the episode here is how can we create some quick wins for creating a positive culture at the practice? Daily check-ins. So this is actually something that I'm working on myself. I have my own office within the practice. It's so easy for me to tuck myself away in there. There's so much to do, obviously, but put my head down and just work all day and like not come out of my little cave. But I want to make a conscious effort to either set an alarm or whatever it may be, come out every hour and a half, take a little lap around the office, check in with people, see if anyone needs anything. And I think that's important too. And, I get to chat with people a little bit that way, but they also feel supported. And usually when I do this, things pop up like, oh, would you mind looking at my computer monitor? Or, EagleSoft crashed or whatever it might be.
Yeah. I think it also gives you a really good opportunity to hear and see some of your coworkers like interacting with patients. When we're up front or in our office all the time, you don't always get to hear, what the hygienists are saying to their patients or how these assistants are, talking to this patient who's in a lot of pain. So just being able to kind of like see them in action and how they're taking care of their patients, and then have you be able to, give them a shout out or give them some feedback, like that's really helpful too. And that's only going to happen when you get up and do your laps and do some listening too.
I was telling Sarah yesterday that I was targeted. I bought some personalized stationery. I love paper and I love stationery, and it kind of just reminds me of my Lisa Frank stationery when I was a kid. Mm-hmm. And I bought some, but I would say for the practice managers out there, go to Dollar Tree, get a few packs of little blank cards, mm-hmm. and write some little thank you notes to various members of the team. I mean, you don't have to give 20 out in one day, but what I would do is kind of, give 1 or 2 out every week or so. Mm-hmm. And I would make them really personalized, mm-hmm. For an assistant, in particular, there's one I'm thinking of, but I would say, she's just our rock. I mean, she is there every single day without fail, 7:30 a.m. We know we can count on her to always be there, never call in sick. Mm-hmm. She just kind of goes above and beyond. And I will write these things and make it very personal to the actual person, like list something specific that they do that no one else does, yep. that you're thankful for. And, we give bonuses and have parties and do this and that. But the way personal notes are received is so much better than anything else. And yep. I think that your team's really going to appreciate those more than you think. So,
yep. I used to do the same, like handwritten notes, and I would love to kind of do work on them during the day and then be able to kind of like hang out a little bit longer that day till that person was gone and just kind of sneak it into their operatory or into their locker or their cubby or whatever you guys have, so that it was kind of the first thing that they saw when they're coming in for the morning. I think a lot of people kind of rush into the office and we get started for the day and we're kind of just like, oh, okay, another day. And it's nice to come into that and have that kind of like set the tone and set the vibe for your day, is like just seeing that nice message. Other things too is like just think outside the box a little bit. One time for me in office, we had an assistant who was really going above and beyond for us to help cover for someone else who was sick. And, it kind of turned into a couple weeks of her like really pulling more weight than just her own and going above and beyond for us. And it was like a, Thursday afternoon or a Friday afternoon at the end of the week. And she mentioned in passing to me, like, oh, after this, I'm going to run to McDonald's and I'm going to get a large fry. And I'm just going to like use that to wrap up my week. And, we joked about how good that was. But after I left and said goodbye to her, I just went and Venmo'd her, $7 and said like, get those fries on me kind of a thing. And it's like, it's $7. And, did she need that to cover the cost of her french fries? Certainly not. But I just think the thought of, sometimes like really truly listening to your coworkers and hearing these things that they mention in passing, or notice that they bring the same LaCroix to lunch every single day and then you show up with a 6-pack of them because you notice that those are their favorite. Like those are the little things I think that people really appreciate, that you're paying attention and recognizing those. And sometimes that goes further than, buying everybody a pizza or whatever. Is like those little touches.
Absolutely. And in kind of going off of actually listening, I think is encouraging feedback too. And just encourage yourself to ask little questions to your team. Like, so if there is one thing that you could change about the office, what would it be? Just small little things like that, I think will guide you and help you shape culture even more, is just by actually listening.
Yep.
One of the things we have listed here is keeping the break room stocked with good vibes and snacks. For that, so as a manager, I know it's easy for us, like at lunch, to want to be like, I just need to take a break and get out of the office. I always try to stay at the office at lunch, and I try to sit back in the break room, and I try to, chat. And honestly, it's one of my favorite times of the day because that's when we talk about like White Lotus and that's when I get to chit chat about all the current events of the world, but also just spending time with the team. So I like being back there. Obviously, you don't need to do that 5 days a week. Everyone deserves a little time out of the office, and a lot of people run errands at lunch and things. But that is something that I personally like to do. And one of my doctors, he always encourages new team members to come back there and get to know us. And he's like, I know it can be a little intimidating to come back and sit at the lunch table with a bunch of strangers who you don't know yet, but it's a good way to get to know us. So please come back there.
Yep.
What else? I think that's about it.
Yeah. I think the only other thing I was going to say is like, all of those quick wins for positive culture, but also don't let yourself fall into any of these traps, right? Like when people are coming to you with feedback or they're frustrated or concerned, it can be so easy for you to kind of jump in with the gossip or the, negative feedback or whatever, and just kind of gentle reminders to yourself. This is where that written culture document can kind of help you to remind you of like, oh, do I want to, feed into a culture of gossip and complaining and whatever? Like, no, I don't. So listen, genuinely, but also kind of try to guide them towards, the direction that you want them to be in, instead of getting wrapped up in it and just feeding into kind of those negative things. You have to lead by example, certainly in the office manager position.
Culture isn't built in a day, it's built every day.
Yes, Exactly.
It really is something to stay consistent with. As with everything we do at the office, just consistency is key. I think a lot of times this is something that just is easily swept under the rug, or it's the last thing you're paying attention to because there's so many other things going on within the office, and like little fires are kind of putting out all day long. But don't let it do that. Don't let it be swept under the rug. Make sure it's a priority. I think once you do start doing that, you're going to notice a difference in your team. So, our last bullet point here was sort of like a culture challenge, which is just starting with one compliment a day to someone, starting with one conversation, asking, one question of a team member. You don't have to go like hard tomorrow, but starting with little baby steps and seeing where that takes you.
Yeah. I think one other thing that I still do to this day is, think back to a time when, most of us as office managers in the dental office, we started in a different position, right? Amanda, you even called it out, like you were in dental hygiene school and you were doing dental assisting. Like all of us, most of us started in a different position. So we know what it's like to work in these positions. And what kind of things did you I don't want to say long for, but what kind of things really resonated with you when you were in those positions? Like, did you like getting pizza once a week? Did you like getting handwritten notes? Did you want somebody to just call out, great customer service when it happened? Like, just kind of think back to those times and say like, dang, I would have really appreciated if somebody would have said, amazing treatment planning, this patient scheduled an all on 4 and blah, blah, blah. Like, think back to what worked well for you and put those things in place. Do those things for your team that are still in those positions.
Mm-hmm. Yep. Even like when I'm doing my lap and I notice the front desk is just really treating, or one of our team members is really treating a patient with care and going above and beyond, or they just had the verbal skills and we're chatting with them really great on the phone, I will mention that because it's important.
Yep.
But all right. That kind of wraps up this episode. Thank you guys so much for listening, and we will catch you on the next one.
Bye, everybody.
Bye-bye.